Introductory webinar. My name is Heather Bradley, and I will be running the webinar for you today. Presenting is Lottie Jameson, and she will get you started.
Hi, Lottie Jameson with the Adirondack Health Institute. I'm a VP for Regional Planning and Development. I've also had the good fortune of working on the DSRIP workforce section. The application for workforce was submitted on December 22nd with all of the other sections of our PPS's application. We wanted to take this opportunity to really kick off our work for 2015. We had over 280 emails of interested participants across the 9-county region, and I believe we have somewhere around 60 folks who were interested in the work of the Workforce Committee, with about 50 plus today registered for this. So I thank you all for your time. This is just an overview of kind of where we are right now and where we're going to be heading next. I just wanted to give folks just kind of a sense of where we're at. So the next slide you're seeing is kind of the agenda. My goal is always to end these types of meetings early, so that will be my goal, and use your found time well. We will have an opportunity at the end for questions, so we'll definitely leave a few minutes for that as well. So we'd like to move on to our next slide. We wanted to give you an overview. I know some folks on the call that are working in a number of PPSs, and I wanted just to give you a sense of what was happening here with the AHI PPS. We applied for 11 different projects. We convened a number of stakeholders across the 9-county region, starting back last September, last April. There were 4 projects that were what we were calling quote-unquote AHI-led projects. And we also worked with 5 regional health innovation teams. And so what we were able to get back from those teams back in December were kind of where they thought they would be with their workforce needs based on a project-by-project level. So what I'm giving you in these next 2 slides is an overview of the 11 projects in total. What you're seeing here on this slide, basically we had these 4 that you're seeing here were the AHI-led projects, and you're seeing this hospital-to-home care. What those 5 regional teams basically put forth to us, saying here's what we think our future state of the workforce is as it relates to this particular project. I would tell you we had variation for sure from different regional teams. This particular hospital-to-home care collaboration, just to give you a sense, we had one team submitting that they would actually need 0 recruitment, and we had another team submitting they needed 120 to be hired. So we'll be looking not only at the projects, the speed and the scale as far as what projects are saying they need to have done over the 5-year period. We'll also be looking at variation amongst the regional teams. And for us, our regions were Fulton County, the North Country, Plattsburgh, we had Queensbury, we had St. Lawrence, and we had the Saranac Lake, I forget the
Northern Adirondack.
The Northern Adirondack team. So they had named themselves as such. So I want to make sure I'm using the right term for that team as well. Next slide. The next set of projects give you a sense of probably where the bulk of the hire, retraining, and redeployment would occur. I would note that none of our projects submitted any reductions in their workforce. We've had a couple of meetings in Albany. Most recently, we were there 2 weeks ago on a Friday, and we heard across the New York State, out of the 25 PPSs, only 5 of those actually had reductions in their workforce plan. So our consultants with KPMG felt that that was probably improbable, if not impossible. We're basically, you know, our stance has been we have so many shortage areas as it is. It's difficult to recruit and train in a rural area. that for us, reductions, we would probably be able to reuse staff in other ways and capacity. So just to give you an overview here, primary care behavioral health integration, looking at new hires, over 100, as is the community crisis stabilization and the increased access to COPD preventative care. Retraining, the biggest number there was also the 4B2I project. And redeployments in general were fairly low. Across all 11 projects, our redeployments totaled up to 50. Our retraining of staff totaled up to about 8. And our new hires and recruit was just a little over 865. So in general, that just gives you kind of an overview. And again, as I stated before, in the other projects, we definitely had variation from regional team to regional team. We did ask people to actually submit what level, what staffing they were going to need. So those categories were things like case managers, IT staff, nurse practitioners, pharmacists, CSACs, psychiatric RNs, home health aides. So we've got a wide range of different occupations as well that our project teams have identified that they would need to be successful with their projects. The next slide we're going to look at is really the budget. This is always a key interest to people. Our workforce is approximately 5% of the overall projected out for the PPS. It's just shy of $6 million over a 5-year period. Year 1 starts April 1st of 2015 and ends December 31st of 2015. So year 1 is just shy of a full 12-month period, with year 5 ending in 2019. We were also recommended to front load workforce so that workforce could be in place in order to help the projects reach their milestones. So you'll see that our funding has been split up about $1.5 million in year 1, $2.5 in year 2, and then decreasing down from there with year 5 having about $250,000 earmarked for the workforce component DSRIP project for the AHI-PS. Next slide. So part of our application, and I believe that all PPSs were looking to do this as well, was really to have a workforce committee. There's you know, a lot of work that needs to be done, a potential for a great amount of impact to our workforce, and concerns that how is this really disseminated out, how is it communicated to current staff, was of utmost interest. So, you know, having a workforce committee has really been a charge of us, and really the philosophy of AHI as far as being collaborative, having folks sitting at a table and listening from people in the trenches as far as what needed to be done. So overall, the role of the workforce committee is for the overall direction to workforce activities. So specifically, we need to be developing a set of strategies that will assist us in attracting, training, and retaining staff in those targeted occupations in order to build the capacity and preparedness to meet the patient population needs through an integrated care system. We're also looking to do a very detailed workforce implementation plan in order to minimize that impact to those incumbent healthcare workers, especially to address retraining and redeployment. And then some of the tasks that the workforce committee would be asked to do, we would like to be able to identify training programs available. We want to identify the staffing needs related to some key areas, but really all of the what actually was identified by our project teams. We need to be able to do a compensation and benefit analysis. This is particularly important in those redeployments. The Department of Health has been asking, you know, we really had to put forth how many people would be redeployed with either a partial or a full salary compensation package, and that was based on a percentage of their salary. So we have to be doing that as one of our requirements. We also want to develop a communication plan to engage our frontline staff. I believe some of our other PPSs are doing what they're calling a DSRIP 101, going into different provider organizations and really sharing with staff what does DSRIP mean, what will it mean for them. So I think that's something that we'll also be looking at doing as well. Some of us are living and breathing DSRIP, but other people really don't know what that means or how it impacts them. So we want to make sure that our frontline staff are engaged moving forward. I believe we'll be doing, I think with AHI, with our PPS, we're also a FIP awardees or a FIP subcontractor. We're looking at building a regional website. So we think that that might be a great way for us to also drive people to a healthy ADK website that'll have health jobs ADK on there as well. So opportunities that people are looking as far as what's opened at a particular facility or provider would be something we would also be able to at least research and investigate moving forward. I would note that we have over 100 partner organizations. Our provider list is nearly 1,400. So the scope over a 9-county region for us, 11,000 square miles. So our challenge is to try to do this to be inclusive and yet be mindful of just the breadth of the partners and the location geography that people have. So again, that was part of the rationale of having the 5 regional teams at the start of this. We are looking at the workforce committee structure to be led by a chair and or co-chair. We're finding that our project teams, our regional health innovation teams, we have an HIT committee. We're finding that those are being, the chairs, co-chairs are being helpful to us as the AHI PPS staff, really engaging the right partners that we need. So we are looking for folks that would be willing to volunteer to serve in that capacity. I was asked what the scope of work would be. I believe right now what we envision our chair, co-chairs to do, we are put quarterly meetings. We would want them to be involved in the agenda, run that meeting. They would have support staff available to them. We are hiring a workforce manager. That position posting is currently open. I'm already interviewing applicants for that. And then there's a potential as you look at the work that needs to be done in the interest, if we have maybe 60 folks interested in sitting on a committee, we are feeling that we would have to break up some of the work into subcommittees. And those subcommittees would probably focus on that previous slide, really, a communication plan, doing the analysis, staffing needs, and again, an inventory of training programs to identify what's available for resources and where our gaps are. So I think initially we're looking at probably those, that could potentially be those 4 subcommittees. I would envision that the two volunteers, our co-chairs, would maybe serve on those subcommittees and then be able to report back out to the full group at those quarterly meetings. We are putting into the overall AHI PPS budget some reimbursement to an organization. If someone is willing to be a chair, we can talk further about what that would look like, but there is some reimbursement. We have identified that we need experts out in the field and that your time is of value. So those are considerations that we've taken into account for our overall budget as well. And let's see, who else? We had a phone call last week with KPMG, our DSRIP support team. Some of their workforce experts have also suggested that we have, in addition to the committee, we have something that we're calling a project team. That committee, it would include our workforce manager and certainly some key AHI PPS staff, potentially consultants. We are considering working with the Center for Health Workforce Studies on some of the data needs that we would have. our workforce vendors. I believe we have all 3 of them on the call today with us. And then we would be looking for a representative from, key component areas. I'm hopeful that this group would maybe be around 10 to 15 people. And the work of the project team would be to probably meet on a monthly basis and then participate on those quarterly meetings as well. So that's really just about, getting a report from the workforce manager. How is this moving? Where are we running into barriers and challenges? We also think that there'll be a great opportunity to work with our other PPSs that we're adjacent to. More after next step. Our timeline. We're meeting today via webinar. Thank goodness for technology. We do have, as far as it relates to workforce, what I wanted to add here is that we're waiting for projects. So we do have the 11 projects are working on speed and scale and also a budget template. And those are due to us this Friday the 13th. So upon receipt of that, I'll be reviewing those to incorporate into the workforce implementation plan. And that draft will get submitted to KPMG next Monday. And I say Monday, it might be at midnight on Monday, or someone here will submit it first thing Tuesday morning. But that's our plan, to get that submitted in a draft form on the 16th. We would then be we've been told that we would receive comments and feedback as we did in the application process from KPMG, and we would hope to review that with this group on the next webinar on Tuesday, March 24th, and that will be held at the same time. That would be 3:30 in the afternoon. So if you wanted to put that in your calendar right after this, you may. The actual implementation plan is due to the New York State Department of Health on Wednesday, April 1st. So those plans, whatever comments, feedback we got from KPMG, we would basically get in the document in the implementation plan before submission. And then just for you to know, we do have projects doing work plans, and those are due to us on April 22nd as well. So lots of information happening, lots going on out in different little snapshot of where we're at right now with the workforce piece of this. We are looking at our quarterly meetings. We'd like to move them around the region. We found that to be a helpful strategy when we did the SUNY Right Professionals in the Right Place project. Starting in October of 2013, that went through about March of this time last year. We would look to have this type of technology available to us. So in the event that people could not attend in person, we would hopefully have the webinar platform available. Just to note, we will have this session is archived. The slides will be put on our DSRIP blog at the adkhi.org website. And that usually gives us about a day or so, but we've been able to post those on a pretty seamless basis. We did a series last Monday for all the projects. Webinars are sitting there as well. We'll add the workforce in the next day or so. I believe there. I'm down to next steps. Look at how fast I am. All right, next steps. I think what we'd like to do is we would send out, I believe our next step is a Survey Monkey. We're going to be asking for folks to determine which subcommittee they potentially would be interested in serving on. With that, we'll send a link to the actual application, our workforce section of our application, so that is available at the DSRIP website at the New York State Department of Health. I'm trying to think, Kelly, was there anything else that we felt?
March 24th.
And then they would be RSVPing to the March 24th webinar through that same mechanism. I would just add here, we've been, sometimes it feels like there's not much happening. There's been, more happening kind of behind the scenes. We've had monthly phone calls that include SUNY system. Heather Eichen, I believe Heather's on the phone. It includes our the other PPS that we're working with collaboratively right now, which is the Samaritan Fort Drum Regional Health Organization. We're also, the phone call included the Center for Health Workforce Studies, and Iroquois is our other workforce vendor. So those have been happening monthly. We also, this particular PPS has been working with the Ellis PPS out of Schenectady, and through our relationship with Hudson Mohawk AHEC, who works with that particular PPS, and the Albany Med. Today is our workforce vendor working out of the Central New York region PPS. So I think I wanted to just give you a sense of, you know, as much as we talk about the 9-county region, there's collaborative work happening in other parts of upstate New York. Our goal here would be to use and share as much as we can as far as curriculum, best practices, great vendors to work with, platforms potentially. So I think that that was also the sense that I wanted to just share with you today, is there's lots of work happening as far as, you know, communication, discussions, phone calls, those kinds of things, but it's really this next step that we start moving forward with implementation planning after April 1st. So our goal right now is about what's our process going to look like, having folks commit to working on our committee, which again, and right now, committee member, we look at probably, you know, participating on a quarterly basis, being informed of where we're at with the different project milestones related to the workforce. And then again, there's opportunities to chair, co-chair, and serve in subcommittee capacities and serve on the project team. So there's much work to be done. When you look at a $6 million budget, you know, basically recruiting over 800 people potentially, retraining over 800 people, and doing all the work that needs to be done on this DSRIP project will take many hands. So with that, we wanted to open this up. If there are any questions, there's directions.
Right, so if you would like to ask a question, you can use the question box on your control panel, or you can use the hand icon to raise your hand, and I can unmute your line if you had entered audio access.
So we'll give people a few minutes if you have any questions you'd like to ask of us. If not, you could probably drop us an email. And you could direct that to me. It's, my email is ljameson, Jameson, @adkhi.org. Again, we'll be putting together an agenda for our March 24th webinar. But if there's specific things that you'd like us to focus on for that, just let me know. We'll add it to the agenda. Do we have any questions?
Okay, so Deborah Flock, you have your hand raised. However, you didn't enter your audio pin, so I'm unable to unmute you. If you can either enter your audio pin that should be provided, or type your question into the chat or question box. That way we can address your question.
Nothing.
All right. Deborah, I'm not seeing a question coming from you, and it hasn't shown up that your audio pin's been enabled. So I would ask that if you do have a question, you would email Lottie directly. A copy of the slides and a copy of the webinar recording will be posted on the DSRIP blog at adkhi.org tomorrow. And again, if you have any additional questions, the contact information to reach us will be posted on the blog tomorrow as well. Thank you all. Have